Today we're going through a series of stretches that we do regularly in our classes to help even out the tension around the pelvic girdle complex, to help keep your knees, hips, and spine in better alignment. And of course, in doing that, helping the rest of your structure. If we could start, even no matter how competent you are, if you wouldn't mind starting sitting in a chair. Here we're going to go through just 2 repetitions of chair version exercises, standing version for those who cannot come to the floor. Then we'll go through the series and your option will be floor or chair, whatever is better for you. So first, just sitting tall, we're working on the hip external rotators, the muscles on the outside of the hips. The legs should be a 90-degree angle. If you could bring the right leg up like this over the left, keeping the left leg square, knee over ankle, toes forward. Now the right foot, flex the toes, pull them up, that will help stabilize your knee. You're not trying to push the knee down. That's not the purpose here. That actually will twist your knee and create weakness around the joint. Rather, we want to release the tightness around the hip where your femur leg bone attaches in the hip. So make sure you're sitting square, centered. Protect the knee, you can even hold on to it, and hinge forward from the hips, keeping the chin tucked. Do not allow your head to drift forward. Now be careful of this. Generally, with the tight hip, people will either twist to the side, the left knee goes in, and when they hinge forward, rather they round their back like that. So in doing that, you're compensating tight hip by over flexing the spine. So rather hold on to the knee, keep your neutral spine position, chin tucked. And as you hinge, just keep square so that you feel it on the outside of the right hip. Keep the foot flexed. Don't worry how low you go. Just keep your spine in a neutral position and chin down. And then sit back. Relax your shoulders, try not to lift the shoulders. I always brace the abs here, hinging in the hip. Don't go too far forward. And definitely don't twist that knee. Perfect. And now so let's switch, left leg up. Keep the foot flexed. Sorry for the noise. So the bottom leg again, knee over ankle, left leg up. Flex the foot, toes are pulled up, hold on to the knee. Shoulders down, hinge forward. Now, ideally, you would feel even tension on the 2 sides. If it's significantly tighter on one side, you can imagine that's causing a shift of your hips and knees and back. And then, of course, the neck and shoulders. So we try to keep that even. Sit up and then one more time, hinge forward, staying center. Notice how you'll start leaning toward the leg if the hip is tight. That's perfect. Great. And now we're working on more of a rotation in the hip joint. So similar position here. If you bring the right leg up over the left leg is set properly, flex the right foot. This time hold the knee up toward the chest. Sit a little heavily on the right hip. Now feel where your hip and leg are attached here. You can feel the contact on the chair. And try to pivot in that joint so you feel your leg bone in the hip socket. Perfect. And come back to center. So no twisting your back, no twisting shoulders even. Keep your head set with your spine and releasing the hip. The rotation of the femur in the acetabulum, the hip socket. That was excellent. And now left leg up. And similarly, you don't want to lean forward. Or bend your back forward, flex the foot, hold on to the knee up toward the chest, sit tall, sit a little heavily on the left hip, and feel that connection of your hip into the chair, and try to pivot in the hip without twisting your waist. Come back to center. And depending on you, depending on your day, sometimes your right hip might feel tighter, sometimes left. But here we want to rebalance it. That was really good. All right, next, if you could stand and holding on to the chair. And even if you're, a good yoga practitioner and you can do downward dog, I suggest we give this a try. I find this really helps people protect their knees from hyperextending. So you set up with a kind of a push-up position on the chair, straight elbows, shoulders down from the ears. Make sure the fingers are slightly angled out, not in toward each other. The hands are shoulder width apart. Bend the knees a little. We're not trying to straighten the knees and put the heels down. If you do that, if you just try that, you'll notice your back will arch out and your knees will hyperextend. So here, rather, you're on the toes, and as you shift back, think about pushing the hips back with your straight elbows. Keep that knee bend position. Push the hips back horizontally and reach forward with your fingertips. And here, what you would like to feel down the sides of your body, the lats, by your shoulder blades, maybe down your arms, triceps, and rock forward, keeping that neutral spine position. There should be no variation along the spine as you do this one. Rock back. So you're releasing the shoulder blades. This is rotation of the scapula and rotation of the femur in the hip socket. Reach from the fingertips, push the hips back so you feel it in your glutes, the gluteal muscles, your buttocks, but not straining behind the knees. Rock forward. All right, that was fantastic. So we're going to continue here, doing more repetitions in the chair as you like, or if you prefer, you can do these on the floor. So if you'd like to go to the floor, we're doing a variation of what's known as pigeon. It's basically a hip stretch. And now I'd like you to, again, the purpose here, we don't want to twist our knees or spine, we want to release the tightness in the hip. So if you're in the chair, you bring the right leg up. On the floor, you start like this on all fours, crawl position. Bring the right knee forward toward the right wrist, and the right foot out toward the left with the foot flexed. And I would suggest if you sit onto the right hip like this. So don't worry about how tight your hip is, you just sit down on that right hip. Now the right foot flex like this, your toes are pulled up, so there should be no tension in your knee. And then, rather than lifting yourself up and compressing the knee, if you stay here and just try to rotate on the outside of the hip where your leg attaches into your pelvis, such that the front of your left hip starts facing toward the floor. And then if you want to, you go right elbow down, left elbow, whatever works for you, don't force it. Keep the foot flexed. Try not to compress the knee, so you're working on in the hip, the right hip. And if you just press the leg down a little, now you're lengthening and strengthening gluteus medius, piriformis, glute max to a certain extent, and release it. Again, press down as you like to, and release it, and press down, lengthening and strengthening equally. Great, and now we'll switch to the left leg. So if you're on the floor, coming up on crawl position, if you're in the chair, left leg up over the right as we practiced earlier and just hinging forward. Floor group, left knee toward the left hand. And now sit over onto the left hip and flex the left foot. And now keep the left hip on the floor so there's no pressure on the knee, not compressing that joint at all. And as you pivot in the hip, where your leg attaches to the body, the right, you'll note the right side of the pelvis starts facing square to the floor. Keep the left foot flexed. If it works for you, left elbow down, right elbow down. Not twisting your back, working in the hip. And then if you just press the leg down a little, try to relax your groin, relax the psoas muscles, and relax. Press the leg down so you feel the stretch and strengthen on the outside of the left hip. And again, press down, stretch and strengthen. Good. And if you would like to, I would suggest you might share this video with some of your friends. This has really helped people with the pain in their knees and backs and of course hips. Okay, next we're doing more of like a rotation, evening the rotation in the spine. If the chair group, you would sit tall, this time you hold the knee up and pivot a little bit toward, I'll describe which side. The floor group, this is a little more complex here. So you lie down on the right side, right on the right side of your body. That left leg goes forward, the right leg back. Right arm forward and left arm back. The arms should be splayed out like the letter T. So the chair group, you hold on to the right knee, and then the knee comes toward the left and head toward the right. You continue that action. Okay, floor group, arms are out, palms up. Then try to splay the legs a little more. The arms are out, so you might feel a stretch in the chest. Left hand, if you can do it. If you can't, you just stay where you are. But if it works for you, left hand, hold on to right foot. If your hamstrings are cramping, no harm, just stay as you are. Right hand, if you can do it, hold on to the left knee. Now the rotation here is left knee goes forward, left shoulder back, equal and opposite, and head turns back. If you could, everyone engage the glutes and then rotate, knee forward, head back, hold. And release it. Again, glutes engage and slight rotation, equal opposite. And then relax. Once more, glutes. And release. Now, other side, the chair group. If you could hold on to the left leg is up, keep the knee up, knee goes right, head left. Floor group, you're lying on the left side, right leg forward, left leg back, right arm back, head turn right, left arm forward. Ideally, arms are out to the sides, palms up. Now, some people will have like significant restrictions, tight biceps, tight pecs. Doesn't the neck also sometimes alignment right? Now, if you can do it, floor group, right hand, hold on to left foot. Left hand, right knee. Head turns right, knee goes left. And then glutes engage, slight rotation, don't force it. Think of the right shoulder back and the right knee forward, equal and opposite. And release one more time, glutes engage, rotate, equal opposite. Release, again, glutes engage and rotate equal. Now, ideally, this feels even on both sides. If you're a right-handed tennis player, golfer, basketball player, or just heavily right-handed, you might notice that the right side here is more restricted than the left side. And again, when you go through this series, it'll help even it out. Okay, so next, the standing group, you would hold on to the seat of the chair as we practiced. The floor group, there are two options. Ideally, toes are curled under. If that doesn't work, you can flatten the feet like that, but toes curled under is better for your hips. Keep the arms really straight, shoulders down from the ears, push into the floor with your hands so you feel tension in the upper back. And now this would be crawl position when you rock back towards child's pose. Here we're working on releasing the shoulder blades and hips. This is not just like a passive loose kind of stretch. Rather, you want to get the proper rotation in the hip socket and the proper flexion of the knees. And rock forward. That was perfect. So if you have issues with your knees, only do what you can according to your hip rotation. If your hips are stiff, you might twist your knees a bit, so don't just work in the hips, keep the arms straight and chin tucked. Again, you don't want to flex and extend your spine, so as you're rocking back and forth, there shouldn't be any arching or rounding of the back. Let's do that once more. Very nice. Now, if you prefer the downward dog version, this is a little different than what you practiced. So as we did on the chair, the knees are flexed, not straight, as you like to. When you rock back, push straight arms, push the hips up so you maintain your neutral spine position, hips up to the sky, strong arms, push into the floor. Keep the knees flexed so
you don't want to feel strain on the back of the knees. You'd like to feel releasing under the shoulder blades and into the hips. In the back of the hips, the gluteus maximus and the hamstrings if you're tight. You don't need to push your heels down forcefully. Let your Achilles lengthen appropriately and then rock forward. Keeping the knees flexed. So the knees should not bend and straighten. You have this bend angle. When you rock back, keep that knee angle and push the hips up. And this will really help you with preventing the hyperextension of your back and knees. And rock forward, and very slow and controlled the way I'm demonstrating, obviously. That was awesome. Okay, so now if you're on the floor, we're going to stand up. Now this is my favorite way. Up to protect your back. You walk your hands back to your legs, sit back toward the heels, hip hinge up. Let's stand up, right leg forward. Make sure the hips are square, make sure the knee is aligned. When you stand up, stand straight up, feet land together. Be careful of getting up and twisting your knee. So next we're going to work on the hip flexors and internal rotators. And my favorite one for this, because pretty much everybody can do it. Again, we'll start sitting in a chair, and then we'll go through a more challenging option. If you could sit on the right side of the chair, and right leg back. Now the back foot should ideally flex and toes angled forward so you don't twist your back, you don't twist your ankle and knee. Now brace your abs, and as you lean back a little bit, center line, you should feel a stretch here along the hip flexors. If your quads are tight, you'll feel it all the way down your leg. And then come back to center. Now lean back a little again, and then just rotate slightly toward the left, keeping your spine in neutral. You'll feel a slight rotation in the hip. And center, and then again rotate toward the right side, keeping everything, don't let your left knee go in, everything stays lined, so we're working in the hip joint, the right side. Okay, that's really good. And now let's go, other side of the chair. Okay, left leg is back. And the toes are flexed, pointing forward ideally. Brace your abs, make sure you're square forward, and lean slightly back so you feel in front of the left hip. And now keeping everybody the hips square, rotate slightly toward the right side. And then rotate slightly toward the left. Recover. Okay, so next version, we're going to do that again twice more. And why I like to go through that extensively is because we sit a lot. When you're walking, often people lean forward so your hip flexors get tight and strain your lower back and knees, obviously. Okay, so another option here, option one, continue what we did, sitting on the chair, right leg back. Option two, left leg forward, right leg back like this on the chair. But here, I mean, it's quite strenuous. The front leg should be knee over ankle, and you stay centered. Rotate toward the left, rotate toward the right. Good. Now other side, my chair is slipping back a bit. If you do that, you have to be careful. The chair must not move. So I like to put it against the wall like this, so this chair is stabilized, because sometimes it slips back. Now we're sitting now on the left side of the chair. If you'd like to do this Bulgarian split squat position, right foot is forward, left leg back. The front leg knee over ankle, your centered position here. And then slight rotation toward the right side. Slight rotation toward the left. Good, and now switch sides again. One more time, you do both sides. You can do this more slowly as you like to. So you can see with this series of exercises, we're evening out the tension and strength around your hips. Right leg is back, center, rotate left, rotate right. And in doing that, you're helping to even the tension around your knees and spine. And for that reason, I've seen left leg back, left side of chair,
that many people, their knees have or feel much healthier. Sciatic issues, absolutely. You know, you align your hips, you're much better off. Center, lean back a bit. Rotate slightly right side. Rotate slightly left side. Great. So thank you very much. I am Uttara. We do these exercises regularly in our classes. And when you're moving around, you know, playing tennis, walking around your home, you'll just feel your knees, hips, and spine will be better aligned so they won't break down. And we've got a long way to go having fun. Thank you for joining me. Please send me an email if you'd like to join our classes.
Nature's beauty properly used can be of tremendous help. Early in the morning you look at the sun, setting sun, morning sun brings hope, light, promise. Evening sun comes, setting sun gives us peace, liberating us from the hustle and bustle of life.